So let's spend the next 5 or 10 minutes debriefing. So a reminder, debriefing is a guided reflection, and our goal is to prove how we work and care for our patients. I want to restate our basic assumption that we're all intelligent, motivated, and want to do the right thing. In a few words, I wonder if you could both share how you're feeling at the moment. Taryn?
Very relieved.
I'm feeling relieved that the end of the scenario had a good outcome, but also excited, recognizing that I have a new skill and a new knowledge base to apply to patient care.
So let's start with a short summary of the case. Taryn, as the primary nurse, can you give me just a short summary of what was going on with Mr. Little?
So Mr. Little was status post coli, and he's also type 1 diabetic, and he had a hypoglycemic episode tonight.
Michael, is that your opinion of what's happening with the case too?
Yes, based on the symptoms and the signs that we observed and assessed.
So let's unpack the scenario a little more. I'm curious about your thoughts following report. Did either of you collectively or individually have a plan or any priorities of care?
So there are a few things in report that kind of we caught on to. It was, his fever, his appetite, and then his lethargy that we kind of knew we needed to pick up on. And then when we started doing our assessment, it kind of unfolded in that way. I guess the plan was to kind of further assess that notion.
So you mentioned the assessment. You started your assessment very promptly, and I did hear, I think, Michael, it was you that said, wow, he's getting really sweaty. So I'm curious what your thoughts were at the time, what you thought was going on.
I thought that was a new symptom for him. As we peeled back the blanket, it was very evident that there was diaphoresis, and he was also a little confused. So putting those two things together, I think, was very helpful to move towards the next steps.
What were the next steps?
The next steps, as we shared our thoughts together, was remembering that he had a history of diabetes and he had not had a good appetite that day, but had received his regular dose of insulin, that the most logical thought was to check for his blood sugar.
You checked his blood sugar, it was 52. So what was your plan of action at that point?
So of course 52 was low and he was symptomatic, so we wanted to treat. And we decided on orange juice, which is PO is fast. And he was awake still, and then when that didn't work, we decided to go for medications and then consult the doctor.
So I heard, Michael, when you were going through the orders, there wasn't any particular order, so you decided to call the physician. So tell me how you felt your communication with Dr. Lopez went.
I shared a standard and recognized SBAR communication with the physician that was very guided. The physician was open to my recommendation. So I felt that that added to my level of confidence as we continued our conversation.
So, and we have Debbie, who was Dr. Lopez in the scenario, joining us for the debrief. So, Debbie, I'm curious if you can share with us how you felt the communication Michael provided for the physician went.
I thought the nurse acted swiftly, appropriately, had great assessment skills, and reached out to me as quickly as possible. I think one of the things that I could do as a physician is provide a standard order for D50 and then call. I think that's something that I would do better for my practice.
So as we're beginning to wrap up, I'm curious to hear from both of you what you felt went well and what you managed well in that scenario and why. Karen, maybe we'll start with you.
I felt that when he started becoming symptomatic, we picked up on that right away, and that was really important. And we didn't kind of glaze over it. And then we started to unpack that. And then I thought it was really good that we started getting, the team involved, and we called the physician and got them part of it.
I believe it worked well for us to approach this scenario collaboratively rather than just as an individual.
And are there any aspects that you would want to change, and if so, why?
I can't think of anything that I would change at this point. I'm really comfortable the way that this scenario evolved and the learnings that we took away.
I agree.
The only one suggestion that maybe I could recommend was if you'd had time at the beginning to look through the orders and noticing maybe that there wasn't an order for D50, that may have been able to get as Dr. Lopez identified, get the treatment. That was the only feedback I can provide.
Excellent,
about
thank
this
you.
summary. So that was a great discussion. Are there any additional comments related particularly to communication, collaboration, and or the management of Mr. Little that we haven't touched upon or that you have?
Well, I thought that as relatively new practitioners, our collaboration was very, very good.
I agree, and I don't think I have any additional thoughts at this point.
Are there any other additional takeaways from this experience that you have to apply to your practice?
I think that as we are moving into our roles as new nurses, the most important takeaway from this scenario was that to recognize that we're never alone and help is just a call away, whether it be a physician call or a call to a colleague for help.
I agree.
So thank you both for your involvement today and your engagement, and that's the end of the scenario.
Thank you.
Thank you.
Thank you.